Diabetes Awareness Month is coming up in November. 26 million Americans suffer from it.
While there are tried and true rules to live by, there are tips, stats, and facts that remain under the radar when it comes to taking charge of your health. Here to talk about some of those, someone who knows firsthand what it's about, Dr. Natalie Strand. She's also a winner of season 17 of The Amazing Race. Good morning, Natalie.
Good morning. How are you?
We're doing well. Okay, first I want to ask what it was like managing your diabetes while you were doing something as taxing and fast-paced as The Amazing Race.
You know, it really was a challenge managing my diabetes on The Amazing Race, but it was just the way we do it in normal life. I mean, every day we come up with unexpected challenges, so it just was more compact. In about 3 weeks' time, I may have had all the challenges I would have had in a whole year of living with diabetes otherwise. You know, packing was probably the biggest challenge. Fitting everything you need for a month around the world in a single backpack was definitely something that I needed some help planning with my diabetes team, but it was fantastic and I had a wonderful time.
And what are some of the things people may not know about diabetes, Natalie?
Well, as you know, November is American Diabetes Month, and Colgate has partnered up with the American Diabetes Association to release this survey to increase people's awareness of the link between oral health. One of the things the surveys pointed out was that about 40% of people living with diabetes don't even know about the link between oral health and their diabetes. This is so important because oral health can be related to poor blood sugar control, which can lead to more complications from diabetes. So the survey really tells us that there is an easy way people can decrease their risk for complications related to gum disease, such as just brushing your teeth twice a day with an antibacterial toothpaste like Colgate.
That's really interesting. I thought it was all about your diet. I thought that was the main part of it, but it's interesting that there's oral health involved too.
Well, you know, diabetes is a systemic disease. It affects your whole body. And of course, diet and exercise are so important, especially for the 80 million Americans that are living with pre-diabetes. But if you already have diabetes, you need to focus on the whole body. So it is your eyes, it is your heart, it is your kidneys, but it's also your oral health. And that's something that just kind of flies under the radar for most people.
Very well. All right, and I know we kind of talked a little bit about the diet. Is there any other good tips that we can talk about when it comes to preventing like type 2 diabetes in your diet?
That's fantastic. That's a fantastic question, and there's good news for everybody that's living with prediabetes that you can reduce your risk by 60% by diet and weight loss. So if you exercise about 20 minutes every day and lose about 5% of your body weight if you're obese, you're really going to cut down on your risks of even ever being diagnosed with diabetes. So there are things that we can do to prevent it.
Awesome. Well, Natalie, before we let you go, I want to know what you've been doing since The Amazing Race and if you have any plans to do anything like that ever again.
I don't have any plans to go on The Amazing Race again, but I've been spending a lot of my time since having that wonderful platform to really raise awareness in the diabetes community. So it was just a great opportunity to teach people that there are websites to go to, for example, oralhealthanddiabetes.com. It's a great platform to encourage people to exercise, to eat well, and also not to let diabetes ever hold you back from whatever your dreams are.
All right, Dr. Natalie Strand, thanks for your time this morning. We appreciate it.
Well, thank you for having me.